Hello, welcome back to the ASMR clinic. I'm Dr. Mitzvah. I'll be working with you today. I know this is not your first time at the ASMR clinic, but if you could just verify your date of birth. Okay, great. And so you had shared with our secretary that this is somewhat of an emergency scheduling at the clinic. Could you speak a little bit more about why that is? Yes, I understand. You're not the first person this week to come in and share that. It seems like right now a lot of people are stressed out. It seems like there's a lot of negativity and a lot of anxiety and a lot of overstimulation. And so I think the service you selected today, the taping, that's going to be really effective for what you're dealing with. But I understand you've never done a taping before, so basically we're going to be taking tape and sticking it to you and peeling it off. And by doing that, we're going to peel off layers of stress, layers of negativity, layers of overstimulation. And so hopefully after that's done, you'll feel rejuvenated, refreshed, a little more positive. But before we begin with that, I am going to light a couple matches around you. So I'm going to go to the side of you, and I'm just going to light the match, and I want you to just watch the flame burn out. Great. We're gonna do the other side. And again, just watch the flame burn until it burns out. Keep watching it. Great. And that was just to clear the air. Now, before we do the taping, I do want to examine your face. I have these gloves. Would it be all right if I touched your face? Okay. So I'm gonna put these gloves on. If you want to listen to the sound of the gloves, I find that can be good ASMR. Okay, great. So I'm just going to touch your face. Yes, I can definitely feel there's an extra layer there. There's a layer. It does seem like it's a bit of overstimulation. I think that would be the biggest thing. I would recommend staying off of social media just for a little while. I'm not saying that's the root cause, but it definitely can contribute. So when you're feeling a bit overwhelmed and overstimulated, staying off social media can help with that. But I think most people use social media and there can be good things to it. So I'm certainly not shaming you. I'm just making a suggestion for the time being while you're feeling a bit stressed out. And we're just feeling. And I'm just gonna take another look. watch my fingers as they move in order. Which hand is further away? Okay. And which one is further away? Okay. And which one is closer? Okay, good. And which hand is moving? Okay, good. And which hand is moving? And which hand is moving? Good. And which hand is moving? Okay, good. Okay, great. Now this isn't really a cranial nerve exam necessarily, but I do find that some of those things, moving my hands, having you tell me which hand is doing what, I think that can really help with grounding. And you do seem less stressed now, so I think you've really grounded yourself for this environment. And now that we've done that, it's time to move on to the face taping. And I hope that you enjoy this experience. Let me know. Okay, so we have the tape here, and we're gonna take an amount here, and we're just gonna put it at the bottom. And so this will just be a sample. I'm just doing it low down so that you can see what's happening. And don't worry, this doesn't hurt. This isn't like a waxing. This tape is special for your face. It's not gonna pull hair off. It's just gonna pull off those outer layers of stress, anxiety, and overstimulation. So we're gonna pull that off now. Okay, how was that? You wanna try another? Okay, so we're gonna put one up here, just a little bit higher up. And I'm going to peel it back slowly, pulling it back. If you want to take a look, this is what it looks like. This is the side. I was touching your face. If you look closely, there is a layer there to be peeled off. So now we're going to do one this way. Okay, we'll just let that sit for a minute. And I'm going to put one on this side as well. You know what? We'll do the other side too. So we have one in the center and one on each side. I find doing it in different patterns can sometimes be helpful as well. Okay, let's see if we can pull this middle one from the bottom. There we go. Okay. And now we're gonna get this side. Okay. The other side. Great. All right. And you know what? We did one at the bottom that was long. We're gonna do another long one in the middle. And we'll do a long one on top as well. that one's more in the middle. Okay. Great. Okay, and let's do one up top. Now a vertical one right here, and a vertical one right here, and we'll do another vertical one. I was thinking about doing horizontal, but I think first we'll do another vertical. One this way. So, and this time we'll cross this one the other way. Okay. You're doing good. How do you feel so far? Okay, good. I'm glad that this experience is going well for you. I'm going to do a couple more individual ones, and then I want to let you know, if you're okay with it, what I'd like to do is end the taping session by covering your entire face. And I'll just leave you for a few minutes with the tape on. During that time, I want you to relax, and then I'll come back in and take it off. So I just want to get you prepared for that before we do it. But like I mentioned, we're going to do a couple more smaller sections. So there's actually a section out here. And there's a section down here. I'm gonna get the outer here. So I'm getting kind of like all the outer edges of your face. Okay. And so I'm just gonna move my hands around. Don't focus on the tape right now. Focus on the hand movements. Okay, we'll take off the corners. So we've got this one. Pull that off. And then we're gonna get this one. And then we did this bottom corner first. And this top corner first. Yeah, do you want to take a look at the tape? All of this was stuck to you. Okay. And so now, do you think you're ready to have your whole face covered like I mentioned? Okay, Good. It honestly is very relaxing. I've had it done. You'll be able to breathe, of course. We're not covering your mouth or nose. We're just covering the rest of your face. Okay, so we're gonna start with some new, fresh pieces of tape. And I'm gonna get the outside perimeter first. And now we're gonna move a layer in. Almost there. You're doing great. You're staying relaxed. It seems like it's easy for you to be relaxed right now. Okay, we just have one more piece. Okay, so you're completely covered now. I'm going to step out of the room for just a moment. I want you to just relax, and I'll check in on you momentarily. Okay, I am coming back in now. I hope that gave you a little bit of time to just turn off and not really focus on anything and just relax. And now I'm going to begin taking the tape off. Okay, here I come. First. Okay. Doing great. Great job. this is the last strip of tape right here. There it is, the last one. Okay. All right, the tape has been removed. Oh, your face looks so much more clear now. I don't see any of that negativity or overstimulation. I don't see anxiety. Your whole demeanor, you just look much more relaxed, so that's really great. I'm glad that you came in for this. It's really important to recognize when you're getting overwhelmed and ask for help when you need it. And so now I would like to, just like we began, I'm going to just clear the air once more with matches. And I'm gonna go in the other direction this time. We'll start on this side. And so here's the flame. Just watch it as it burns out. It's flickering. Okay. And now let's do the other side. There you go. Watch this flame. Watch it burn. Okay, great. Thank you so much for coming in. I'm going to step out of the room. Take a minute for yourself if you need to. You're in a very relaxed state, so don't feel like you have to suddenly get up and rush to leave. So once you're ready, you can go out to the front, and the secretary that you spoke to earlier will help you with checking out. Thank you so much. It was nice to see you again, and I hope that you're able to maintain some inner peace for the coming weeks or months or until we see you again. Okay, goodbye. Hi everyone, thank you for watching my video. If you enjoyed this video, please like, please comment below, and please subscribe to my channel. I put out videos almost every week. And as always, Toda Rabah, Laila Tov. Thank you very much and good night.